website and we put prices out there, right, and we put dollars on, because we want patients who don't have insurance to know that if they really do need something, like we have the capability to help take care of them. Like you said, for much cheaper than a typical hospital or anything like that. There you go. Take that. Perfect.
Yeah, that's wonderful, especially right now in today's time.
Oh my gosh, yes. Yep, exactly.
Hopefully we get a little bit of help somewhere.
Yeah, that's what we're definitely all feeling that, that's for sure. And the really nice thing, and the reason I'm so passionate about this is because it's just better for healthcare in general, in my opinion. And honestly, it's way more work for us, and it's not like we get anything back for that. Like, especially when patients have insurance, we make less money per case.
Yeah.
But it allows people who are really sick to get surgery without all the risks of anesthesia. And so it's a big advantage to those patients.
And sometimes there's a wait list of 6 weeks.
Yep.
4 to 6 weeks.
And like I was telling you, I mean, we're taking care of people in wheelchairs who, can't lay flat for any amount of time because their lungs just start giving out, and they're, high risk for going under on anesthesia. And so we're able to, help those people and do that kind of stuff. And it's really, been a game changer for those patients. So that's, and that's really nice, because that's why I kind of went into this,
Yeah. That's great.
Creepy?
Freaky, like
Freaky, yeah, that's fair.
I have to look though, and just morbid.
No, you're interested. There's nothing wrong with that. Good. Pressure, 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 okay? Let me know if anything's sharp. Pressure, 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 pressure.
I really felt that one release when you did it.
Yeah, this is the bad one.
Switch hands. There you go. Left hand up here. Perfect. There you go.
I felt it give way when he released that
Yeah,
part.
I feel like this one's really thick. Because my hands just always feel tight.
Oh man, there's so many times where she woke up in the night just like screaming in pain.
Oh man, ouch.
Just like, mostly it was always numb, but then it would be like that crazy pain sometimes with it.
Yeah, the numbness would be like, annoying, but then the waking it up is the painful part.
Really nice. Okay, some pressure here. Gonna spread. We should put that phone on a gimbal.
Yeah, you're right.
We'll get you some better footage.
Yeah, I'll have to look into that actually, what a gimbal is. We're trying to start a farm.
Oh man.
And so.
You don't really need a gimbal for farming.
No.
I don't, but maybe.
We need a drone. That'd be cool.
Yeah,
Film it all
that
out.
would be cool.
Well, DJI just got like some sort of weird ban on them.
Oh really?
Yeah, they're a really popular drone company,
Yeah.
but they're from China, and so
Oh no.
they got put on one of the blacklists or something like that.
They're spying on us.
Feel that?
I felt that a little bit.
Okay, sorry, but that
That
was
was
it.
a big one.
That was a big one. You're exactly right. Come out there. Go this way.
Yeah, drone footage makes
There you go.
makes YouTube videos amazing.
Exactly. Makes everything much more cinematic.
Yeah, even if they just do like the intro of drone footage, like
That's all you really need.
yeah, it's just really cool.
And then you can do, regular small stuff after that.
Exactly.
Sorry, you okay?
Yeah, I just feel like a little
Weird sensation?
weird sensations. Yes, it's my nerves.
Yep. Well, you're very, like I said, you're very constricted here. We're finally getting that pressure off of your nerve.
They're like, oh my god, I'm alive.
Yeah, that's what
I can breathe.
I can breathe. It felt instantly like I have motion in my hands.
Like I said, I don't ever like to get patients' hopes up, but a lot of patients do come in and say, that night after surgery, I went to sleep and I didn't have the same, tightness and fullness that I normally have. But yours has been going on for a long time, so we'll just have to wait and see how you do, how you recover. Everybody's recovery is different.
Yeah.
I'll tell you what's actually really cool is that since you're awake and we're doing this all under local medicine only, I was actually able to see the blood go back into your nerve.
Really?
Oh, wow.
Yeah.
Rush back into it?
Yes, yeah. It took about 10 seconds and it started going right in.
Because I was wondering like how much blood circulation I've lost, because when I hold my hand above my heart, 10 seconds, it'll go to sleep.
Yeah.
So I probably have like no
That's
circulation here.
amazing.
God, it's gonna be so nice.
I got
Oh,
it good.
I'm sorry.
No, you're great.
I don't know what I was thinking.
We're good.
I
We're
got
great.
most of it. That was
The
awesome.
video.
Tell you, we got a gimbal footage next.
And it's okay for my hand to just have like the tendons you don't have to cut out. Like, they're just
Correct.
gonna
This
hang
is
out.
just the transverse carpal ligament that we release. It's something that we do all the time,
Yeah.
very common. And yes, there is no long-term consequence for the vast majority of patients, right?
So the cut tendons just like
The
hang out.
tendons are fine. They're
Oh.
not cut at all. They're
Oh,
just they're in
ligament.
the ligament just hangs out exactly.
Okay, gotcha. I keep
There's
mixing
some
them up.
debate about all that and whatnot, but yes, for this is the gold standard in terms of treatment. You know, this is what the vast majority of people do for this problem. There are lots of things we can talk about, like conjectures, and talk about that are, interesting ideas floating around the, international community of hand and plastic surgery. But no, carpal tunnel, release the ligament, the nerve gets better the vast majority of the time.
I'm so excited.
And like I said, most patients, those nighttime symptoms improve first, and the daytime symptoms later.
That's fine. Yeah, nighttime is my main problem.
That's what most patients say.
Hold my phone for like 10 minutes,
Yep.
pause it. But
Oh yeah. Back in the day, we used to ask patients, oh, do you get it when holding a book or holding a newspaper?
Yeah.
But now people don't do that. People don't read newspapers,
Uh-huh.
with their hands anymore. They read them on their phone. So now we ask, do you get the symptoms when you drive or when you hold your phone?
driving, yeah.
Or do you have an iPad? When you hold that up, do you get symptoms? And people, oh yeah, definitely.
Is that a metallic stitch?
No, it's made out of nylon.
Okay.
Yeah.
Cool.
You work it works really well.
So
Yeah.
whenever it's time for the stitches to come out, y'all are about an hour away.
Yeah.
Can you remove stitches yourself or somebody else?
I see what we're reading.
Yeah.
Yes, of course you can.
Okay.
It is not in any way our recommendation to do that.
I know, of course.
But it is completely reasonable. I have had many patients do it in the past. If they have a fine-tipped scissor,
yeah.
right, and they can cut it,
We have some like nose hair trimmer scissors.
yeah. Then
Clean them, of
many
course.
patients have done that. Usually, if you're going to do it on your own, I tell you to wait at least 2 weeks.
Okay.
That's a little longer than we would wait if we were doing it in clinic, but it also just ensures that everything's healed up beautifully and can handle, you doing it,
Okay.
right? So I've had patients do that. When they've done it, the key thing about these stitches is they're a mattress. Okay. Now all that means is the way that we put it in. So when you cut it, if you were going to, right? You don't just cut underneath the knot, right? There are 2 pieces right here. If you cut both, then this piece still stays.
And you have to
Okay.
fish it out.
So you just need to cut here,
Okay.
like that, or you cut over here and you just cut one of those 2 limbs.
Okay.
And then the whole thing will pull out. So
Cool.
you just cut one side over there.
It's like an internal stitch. You
Yep.
don't see much of the nylon.
Exactly, it's going underneath.
Cool.
Okay.
If you were gonna do that. It
Thanks
is
for
in no way
watching.
my medical recommendation.
I know, it's okay.
Funny stuff. All right, bend your elbow up. Mary, give me a pinch here on the 4x4. We'll get you dressed up.
Honey.
Got it.
Super easy.
There you go.